Hey, what's going on, CPAP Nation? Are you guys having problems getting used to your CPAP equipment? You have a loved one who's not using his equipment at all? The statistics say that 50% of you are going to fail, but I want 100% of you to succeed, and I'm going to share my pro tips that the sleep doctors aren't going to teach you, and your CPAP supplier isn't going to teach you. Stay tuned because I'm about to give you my pro tips. So if you guys are watching this video, you've made the first commitment for you or your loved one to be compliant on CPAP. Not so much for reimbursement, not so much for billing, but it has to do with your health. So the first thing I want you guys to do, I want you to Google the health risks associated with untreated sleep apnea. It increases your chances of heart disease, heart attack, stroke, Alzheimer's, dementia, depression, anxiety, daytime sleepiness, diabetes, and even some cancers. That should get you motivated into taking your therapy very seriously. End of the day, guys, you're not taking any of these drugs with bad side effects. It's air. It's air to open up your airway, to get oxygenation to your tissues, to your brain, to your heart. And the motivation should be to live a long, healthy life, because sooner or later, if you're non-compliant with your CPAP, it's going to catch up to you. You're going to look back on your life and you're going to wish you used your CPAP equipment when you had the chance. My next tip, guys, is to Google your own CPAP supplier. Wherever your doctor wants to send you, wherever the sleep labs want to send you, do not listen to them. Am I saying that because I think they're incompetent and they're bad? No, absolutely not. I think most of them are very good at what they do, and if they have a drawback anywhere down the line, I think a lot of them are awful with the referral process. A lot of politics can play in the referral process, and you got to remember that a lot of doctors, a lot of sleep labs, they're on a bonus structure, on a quota system. And a lot of times the national companies can do dirty little things for these sleep companies, like waive patient copays so they can do follow-ups with these sleep centers, because if a patient's non-compliant, they can't go to a sleep center for a billable. So if you haven't used your machine in 5 or 6 months, you can't keep going to the sleep center for follow-up visits and expect them to get paid. But oftentimes they can put pressure on the national companies to do so. When I worked for the hospital, a national company used to bring lunches every Friday. In return, I watched the therapists, I watched the departments push patients to this company over lunches. And this company currently today has awful, terrible reviews. At the end of the day, this is the way I look at it. If you guys are at a place you've never been before, you're Googling reviews, you're looking for restaurants, you're reading those reviews. You guys should be doing the same thing with your CPAP company. Not all CPAP companies are created equal. Everyone has a different process. And believe it or not, most CPAP companies I see have negative reviews. Do your own diligence. I say time and time again, you are your own best advocate. Doctors I know refer patients to a certain company because of the relationship they have with somebody at the company or with the representative they have. Either they want to help them with their quotas or they have some type of an arrangement. You guys have to break that cord between your doctor and the referral system. You need to choose on your own. You can use Google, you can use Yelp, you can even call your insurance company. You can ask them for a list of providers as well. Which ones have the fewest complaints against them? I can tell you, I have customers, I have patients that have bombarded certain companies with complaints, yet they are still the biggest referral sources for these sleep labs that I deal with. If you guys did an in-home sleep study, chances are you're not going to be fitted for a mask. You're going to rely on a medical supplier, a DME company, to fit you for a certain mask. After you've done your research in finding a medical supplier, ask the respiratory therapist how many years have they been there, or how many setups do they usually do in a day. You don't want to get a guy who's there for his first week. There are therapists such as myself who've set up thousands and thousands of patients with different masks. We've heard the negatives, we've heard the positives, and we've seen which ones have had the greatest success. One of the biggest annoyances I have is when somebody comes in and said, I did research, this mask is the best, and I want to use this mask and nothing else. And oftentimes we're looking at your facial structure, we're looking at your cheekbones, we're looking at the size of your nose, we're looking at the length of your nose, we're looking at the length from the bridge of your nose to the bottom of your chin. We're seeing if you have facial hair. Are you claustrophobic? Do you suffer from anxiety? We're seeing how wide your cheeks go. These are all variances that go into my head when I'm setting you up for a specific mask. So when you come in and tell us that this mask you read great reviews of, we know know about that mask because all the manufacturers, they can't wait to tell us about it because they want us using that mask on their patients. So find somebody who's really experienced and let them be the best judge to determine what mask is going to fit for you. The mask you get, give it a week or two. Don't give it a day or two and say, oh, this mask sucks. Give it at least a week, try it out, because a lot of masks that I've used that I didn't like the first day or two, or even masks that I've loved the first day or two, my opinion has completely changed a week or two later. So give it time. Also know that all manufacturers such as Fisher & Paykel, Philips Respironics, and ResMed have a 30-day mask guarantee. No matter what supplier you go to, they should be giving you at least one exchange, one return on a 30-day mask guarantee. And if they're not, complain to the manufacturer, because that is a golden rule in our industry. If you guys had a sleep study at the hospital where you did what's called a titration study, the titration study will be a follow-up from the original study where they put different masks on you. You may try a nasal mask, nasal pillows, a full face mask, and what they'll often do is they'll determine what mask you were best suited for that night, and chances are they'll want you on that specific mask and that specific brand. But that is bad in another, because a dirty little secret in the industry is a lot of times the brand that they're mask dispensing to patients is one they got the cheapest deal on. So do you want a brand mask that came in at the lowest bid and probably has crappy samples? I tell you lately, a lot of patients that are coming into me are coming in with 9 or 10-year-old versions of masks. And the only reason they are is because some of these sleep centers have gotten a deal of a lifetime on those masks. All I have to say is find out during your titration study if a nasal pillows, or a full face, or even a hybrid mask worked for you, and ask your doctor not to brand out that script, because if they brand out that script, that supplier, if not under the insurance, has to give you that exact mask, that exact brand. And that's no good, because I can say with 100% certainty, Fisher & Paykel, Philips Respironics, and ResMed all make solid quality masks in all three categories. You cannot go wrong with one of those three companies. If you're going to be subjected to something that's 8 or 9 years old that wasn't that good to begin with, don't put yourself in that situation. The other thing, guys, it's 2019, and the only two CPAP machines you should consider are the Dream Station by Philips Respironics or the ResMed AirSense 10. And I believe Fisher & Paykel makes a great one too called the Ikson. Highly recommend, if you guys are going under Medicare, Medicaid, or third-party insurance, you pick one of these two machines. They're very different. They're in shape, sizes, how they come apart. So one of my biggest issues in the sleep industry is that doctors will brand scripts to a specific machine. Don't let them do that. Do the research, go to your supplier, ask them what the differences of the machine are, and I'm going to show you one specific difference between these two. ResMed has a machine where the humidifier does not disconnect completely. The Dream Station has a disconnect feature for the humidifier. They're two different shapes, so you have to imagine one of these on your bureau. Which one's better? They're really equal. I would say it's less than a 1% defect rate for both of these machines. Same 2-year warranty. You guys, you can't go wrong with either machine. I know people that love the Philips brand a lot more, and I know people who love the ResMed brand a lot more. So you're not going to know that until you do your research, so don't have the doctors branding your scripts. One of the most important tips I'm going to give you guys is have a positive attitude. A never give up positive attitude that this may take weeks, this may take months, but you're not going to give up. You're going to do anything possible. And if you're watching this video right now, I know you are. Because 50% of the people out there are going to fail and 50% are going to succeed, and I want 100% of you to succeed. And it starts with a positive, never give up attitude from day one. I've been on CPAP for 8 years. I remember the first night that I started using this. Think about it. My entire life, I've never put a mask on. I didn't have a come in right in my face. So how am I supposed to fall asleep like that? It took me about 4 weeks to get used to it. I think the first night I slept for a half hour. I built up. Some nights I would take it off. I wouldn't even remember it. That stuff still happens today. I still have bad nights even 8 years later. One of the best tips I can possibly give you is to wear this mask 30 minutes to an hour before you go to bed. Whether you watch TV, you're on your phone, you read a book, whatever you do, Do this a half hour to an hour before you go to bed. That's going to help you acclimate to it. So when you're about to lay down, go to bed. Be a lot easier for you to fall asleep. In the long run, it's going to help you become successful. Make sure you guys use the ramp feature on this. And that's just a fancy word of the machine starting off at the lowest possible pressure, which is 4, and you set the time. I would recommend at least 25 to 30 minutes if you're a beginner, and you can work your way down as you become more advanced. I'm going to show you guys how to change the ramp on both of these machines. So if you guys have the ResMed device, you're going to turn this knob till you highlight the top in blue. You're going to press the button in, and I'll show you the menu here. So you have the ramp time right there. You can do auto. I don't like auto because it incrementally goes up even if you're not asleep. So I like that at 4. So there, you're just going to press that on, and then you're going to turn the knob till you hit, let's say, 30 minutes to be safe. Press it in. Go to home. And then when you start it, it's going to go straight to 4. And you got the time there for 30 minutes. That's how you set the ramp on that device. You can increase it as high as 45 minutes. If you guys wake up in the middle of the night, you want to reset it, turn the power button off, and then turn it back on to completely reset it. If you guys have the Dream Station, you have the same knob where you can turn and scroll through different menus, except it's side to side. So you will scroll until you see My Setup. You press the button in. You got ramp there. You can actually, on the Dream Station, increase the ramp to 5. I had a patient the other day who said 4 felt like he wasn't getting anything, and he wanted me to up that, so I started him off at a 5, which was great. Then if you scroll to the time, press the button in, and you can control the time here. Press it in, 30 minutes, power button on. It'll automatically go to an 11, but you have this ramp feature, this little button. You press that, and it will automatically go down to 4 for the 30-minute time we just programmed. So let's say you guys tried ramp and you're still having no success. It's still difficult. Rich, I'm on a pressure of 4 for a half hour. It's awful. I still can't fall asleep. What else can I do? I'm going to tell you another little secret that the sleep doctors aren't going to tell you, and what they get paid for on the follow-ups. Show you how to get into the clinical menu to do what's called an EPR change, expiratory pressure relief, or change a flex setting. And all that means is that when you exhale out of the machine backs off the pressure. So you're inhaling a higher pressure, you're exhaling against a lesser pressure. In our industry, we call it bi-level or BiPAP treatment. The increments aren't as extreme on a CPAP machine, so it's still classified as a CPAP or an auto CPAP you're on. Let's get into the clinical menus. In order to get into the clinical menu of the Philips Respironics, you're going to hold the ramp button down, and you're going to press the button in, and you're going to hold that for about 5 seconds until that menu pops up, and you're going to know you're in there because you're going to see this little machine wheel at the top. So all of a sudden we have therapy, and we go to comfort. So we're going to hit on comfort, and all of a sudden we have a menu you cannot see in patient mode, and there's a flex setting right there. C-flex is just the pressure is going to drop as you exhale, and C-flex plus, the pressure is going to drop right at the end of your inhalation. To make things simple, I would suggest doing C-flex, pressing it, and then you can go as high as a 3 on this. I would suggest right in the middle for a 2. To get out of the clinical menu, you would just press power, and you're out of the clinical menu. In order to get into your clinical menu here, you're going to press the home button in, and you're going to push the button in. And then all of a sudden you're going to see settings and sleep report. You're going to click on settings. You're going to scroll all the way down to comfort. And right under start pressure, you're going to see that EPR. That means expiratory pressure relief. And again, just like the Philips, you're going to press it on. And if you scroll one more time down, you can go full time. In the EPR level, you can go as high as a 3. Right at 1 or 2 to start off with is absolutely fine. If you need more, you can bump it up to a 3. In order to get out of the clinical menu, press home, scroll up, and hit exit. I want to make it perfectly clear, guys, I don't suggest changing your own settings at all, so don't go into any other menus where you can change your settings. And you can tell if you have your same setting by pressing power button on, and right in the corner it's going to tell you your current setting. If you guys are still having problems after the ramp, after C-flex, after expiratory pressure, then I want you guys to go to your doctor, your primary care doctor, and tell them, I want a settings change, doc. I can't get used to my pressure, it's too great. So if you, for example, if you're on a pressure of 15, maybe they'll bring that pressure down to a 10, or maybe they'll give you an auto set between 6 to 10 to help you get used to it. Yeah, you're probably gonna have a lot more events, but it's going to give you a starting point to help you get acclimated to it. If you go down to a lower pressure and it still fails, I would then ask your doctor to bring you down to the minimum pressure, which is a 4. Doesn't matter how many events you have, because I'm telling you, starting at a 4 and not giving up is a lot better than not using your machine at all because you can't fall asleep on your machine and you've given up. So is our goal to go down to a 4 and stay at a 4? Absolutely not. If you have to go down to a 4 because it's so hard for you to get used to your machine, when you start falling asleep and getting used to that pressure, then your doctor can slowly and gradually bring you up. You need to work with your primary care physician. I know a lot of the sleep labs in our territory are booked out 3 to 4 months. That's why I've offered a walk-in facility. You guys can email me at richard@footit.com. You guys can leave comments. I answer them. I don't have people who answer my emails. I don't have people that answer my calls. I don't have people that answer these YouTube comments. It's all me. I work 7 days a week. I love what I do, guys. I love interacting with you guys. I'm there if you need me. My last tip for you guys is to join CPAP Nation. It's a chat forum I've started on Facebook. I'm going to provide the link below in the description. Click the link, ask to join. It's a private group. It's public, can't see it. There's a CPAP community just like you guys. We're there to help. We have professionals on that site. We have people who are struggling, new timers, people who've never been on a CPAP machine. And for you guys who are experienced, we need you. We need you in there helping people who are not experienced, who have questions. So please join CPAP Nation. Hey, I appreciate if you guys hit like, subscribe to this channel. And if you think I missed anything or you guys can offer any great tips for the people watching this, please put them in the comments section. Thank you guys and God bless.